Imagine your heart is a drum. Now imagine it beating so fast, 180, 200, 250 times a minute, that the sound blurs into a single, terrifying scream inside your chest. You're dizzy. You're breathless. You feel a cold wave of panic because you're convinced this is the end. Most people in this situation rush to the emergency room, trembling with fear. But what if I told you that your body has a hidden kill switch for this exact nightmare? What if you could force your heart to screech to a halt and return to a normal rhythm in seconds, sometimes without a single drop of medication? I am Dr. Cardiologist. I am a specialist in cardiovascular health and the mechanics of the human heart. Today I'm going to pull back the curtain on a condition called SVT, supraventricular tachycardia, and show you the exact evidence-based protocols that ER doctors use to save lives. One of these techniques is something you can actually perform on yourself before you even call an ambulance. Stay with me, because understanding this switch is the difference between losing control and reclaiming your life in a moment of crisis. To understand how to stop a racing heart, you first have to understand the electrical highway. Normally, a single signal travels from the top of your heart to the bottom, triggering each beat in perfect, rhythmic order. But in SVT, that car gets trapped in a deadly loop. It spins around and around at 200 miles per hour, triggering beat after beat after beat. This loop almost always passes through a tiny, critical junction called the AV node, the gateway between the upper and lower chambers of your heart. If you can jam that gateway for just 1 second, you break the loop. You stop the race. This isn't guesswork. This is the official protocol from the American Heart Association and the American College of Cardiology. And the very first thing we try isn't a drug. It's a physical hack called a vagal maneuver. It works by stimulating the vagus nerve, which runs from your brain directly to your heart. When you activate it correctly, the nerve acts like a powerful set of hydraulic brakes on your AV node. But here is the crazy part. Most people have been doing the vagal maneuver wrong for decades. The standard version only works about 17% of the time. But there is a secret modified version that more than doubles that success rate to 43%. In a study of over 1,200 patients, this technique was nearly 3 times more effective and slashed the need for emergency drugs. Here is exactly how you perform the Dr. Cardiologist modified protocol. Step 1. The strain. Sit upright at a 45-degree angle. Blow as hard as you can into a syringe or your own closed fist for 15 seconds. You must blow so hard it feels like you're trying to inflate a concrete balloon. Step 2. The pivot. The very instant you stop blowing, you must lie flat on your back while someone else throws your legs up to a 45-degree angle. Hold them there for 15 seconds. This sudden surge of blood back to your core triggers a massive reflex response that slams the brakes on your heart's electrical circuit. Step 3. The reset. Return to a semi-upright position and breathe. But what if the maneuver fails? What happens when the physical switch doesn't work? That's when things get intense. In the ER, we move to a medication called adenosine. This drug is extraordinary, and it is equally terrifying for the patient. Adenosine is essentially a hard reset button. We give it as a rapid-fire intravenous push, 6 milligrams followed immediately by a saline flush to drive it straight into your heart. Because the drug has a half-life of only 10 seconds, speed is everything. 90% of the time, it terminates the SVT instantly. But you have to be prepared for the feeling. 62% of patients feel a sudden, hot flush. 12% feel uncrushing chest tightness. Many feel a brief, overwhelming sense of impending doom. It feels like your heart has stopped, because, for a split second, it actually has. But then, the electrical system reboots, and the rhythm returns to a calm, steady 70 beats per minute. I want to pause here and ask you a very serious question. Have you ever felt your heart skip a beat or suddenly take off like a racehorse? Have you been told it's just anxiety? Type heart in the comments if you've experienced this. I read every single one of these, because far too many people are suffering in silence from a condition that has a solution. Now, here is the unexpected twist. Many people confuse SVT with atrial fibrillation, or AFib. But as Dr. Cardiologist, I must warn you, the vagal maneuver and adenosine will not stop AFib. Why? Because AFib doesn't depend on the AV node loop to survive. It's a chaotic storm in the upper chambers, not a single highway loop. If you've been diagnosed with AFib, you need a different roadmap entirely, which I will cover in my next video. For those who suffer from frequent SVT episodes, you don't have to live in fear of the next impending doom moment. There is a permanent cure called catheter ablation. It's a minimally invasive procedure where we thread a tiny wire into your heart, find the short circuit, and evaporate it with radio frequency energy. It effectively removes the loop forever. Most patients are never taught these survival techniques. They spend their lives terrified of their own pulse, rushing to the ER over and over again. But today, you have the science. You have the modified protocol. You have the kill switch. Here is my challenge to you. Share this video with a spouse, a parent, or a sibling. This 15-minute explanation could be the one thing that helps them stay calm and survive a critical moment. Take this information to your next cardiology appointment. Ask your doctor, am I a candidate for the modified Valsalva? Reclaim your independence from your heartbeat. I am Dr. Cardiologist. Take care of your heart. It's the only one you've got. I'll see you in the next video.